All right, Ken. Stick around.
Sure.
Larry Summers is coming up. So.
That's right. Our next guest
You got
this
a razor
morning.
so I can cut my throat?
Our next guest is former Treasury Secretary Larry Summers. He has been very outspoken on tax reform. In fact, he's out with a new op-ed. It's called, "Yes, the Senate GOP tax plan would cause thousands to die." He will join us right after the break. Stick around. Squawk will be right back. Okay, former Treasury Secretary Larry Summers responding to the tax bill and the impact that it could have on health care coverage. In a new op-ed out overnight, it's called, "Yes, the Senate GOP tax plan would cause thousands to die." Let's bring in former Treasury Secretary Larry Summers. He is currently the President Emeritus at Harvard University. And Secretary Summers, your op-ed, you've probably been the most vocal person out there really speaking about what you've seen in the bill. Do you want to explain your latest op-ed?
Look, I think this bill's very dangerous. There's pretty clear evidence looking across different states and looking when health insurance has been phased in and out. When people lose health insurance, they're less likely to get preventive care. They're more likely to defer health care they need, and ultimately they're more likely to die. And it's very hard to quantify precisely. My piece explains why an estimate that thousands will die as a consequence of this bill is actually a very conservative estimate, done much more carefully based on much more rigorous evidence than the absurd claims made by some that this bill will somehow pay for itself.
We had Mark Bertolini here today, the CEO of Aetna, and his point is that there needed to be a fix for healthcare and the problems that have come up over the last 8 years. He says there needs to be a bipartisan fix because it's a one-sided bill, much like the tax bill. You have nobody who's touched it in 8 years. He says there have been problems that have been cropping up all along, and he'd like to see a fix much more akin to something that you've seen in the Murray bill that's been put forth, the bipartisan Lamar Alexander bill with Patty Murray. What do you think about that idea? Just that.
Look, I think it would be great to start doing things in a bipartisan way, but that's going to require not passing major pieces of legislation hours after the relevant staffs have had a chance to evaluate them. That's going to require holding hearings on pieces of major legislation. That's going to require doing all sorts of things that it doesn't look like the administration and the current congressional leadership want to do. But I completely agree. We don't have health care where it needs to be. There are a ton of issues, both in terms of access, in terms of costs, in terms of the right treatment of employers that need to be addressed. And it would be wonderful if we could address them in a bipartisan way. But when we have government by tweet, that's not going to happen.
Larry, Ken Langone, how are you today?
I'm good, Ken. How are you?
I'm fine. I'm, so to speak, in the trenches on health care with our medical center here. We merged a couple of years ago with Lutheran Hospital in Brooklyn, which is at an economically depressed area. The quality of care has gone up in that I can guarantee you by the statistics we see. And let me address the issue of thousands dying. If one person dies as a result of this tax bill, shame on us as a society. I'm sorry, but I think, pardon me, that's a bit of a dramatic statement, and I'll tell you why. Look at life expectancy in America. Look at how much better we're doing year after year after year. I was at a session up in Harlem last week about healthy living, the food we eat. And these are poor kids in an economically depressed area where we're pushing to these people about the quality of food, what they eat, how they eat it, and so forth. Yes, are there going to be people that can say, I didn't get the health care I needed because of the tax law? I'm sure that's the case. But generally speaking, I think the health care industry has done a hell of a good job, including all those wonderful meccas up in Boston, of making sure that people who need care get the care. And I think frankly, this argument that people are going to die is a little bit more emotional than I think the issue calls for.
Ken, here's the thing. You're right that there's a ton that's splendid in our healthcare system, but people have had a chance to look at the data, both Democrats and Republicans, and here's the amazing fact. People like you and I in the upper part of the income distribution, our life expectancy is soaring. People with below average incomes, particularly men, for the first time in American history, their life expectancy has actually started to decline. So if you had a concern that we weren't doing enough for access, the pattern you see in the data is exactly what you would predict. And yes, there are terrific pockets. What you've done in the New York area, there are things that have happened in Boston that are terrific. But overall, we are seeing a huge increase in the dispersion in life expectancy of those who are left behind. And what the research I cited in my article shows is that if you look at where the increases in mortality are, they're particularly in those kinds of conditions where missing out on preventive care would be especially important, where access to medical care would be especially important. So I agree with you that if anyone dies as a consequence of our changes in healthcare policy, that's a tragedy.
Absolutely.
But I don't see how you can look at careful studies. I mean, the studies I quoted were done by a woman who served on President Bush's chairman of the on President Bush's Council of Economic Advisors. So you look at the studies, you look at the pattern in terms of people with different incomes. I got to say that I'm going to put more weight on that than I am on your instinct, and stick with the conclusion that people will die as a consequence of this bill.
Larry, your instincts about the stock market a year ago was that it was a sugar high. We were only up about 5% at that time. Now we're up a full third, 33% on the Dow. So is it still a sugar high, or what do you attribute it to? And do you think it's going to go down 33% when it finally figures out that it's been snookered or something?
I can't predict what's going. I can't predict what's going to happen to the stock market, or I can't predict what's going to happen to the economy. I can say this: we always advised both President Clinton and President Obama that, and their political staffs, that it was a big mistake to brag on the stock market because, as Bob Rubin used to say, markets go up, markets go down.
Right, but something that you missed.
If you take credit when markets go up,
okay, but what happened?
You're going to have to take the blame when markets go down.
Okay, but you absolutely did not see a 33% rise in the stock market coming. You thought that it was a sugar high to be up 5%. So what did you miss about a market that goes up?
What did I miss? I missed a ton of developments that happened in the corporate sector, and I missed what happened globally. I mean, the interesting thing is that if it was all an American thing, you'd expect that the American stock market would have outperformed foreign stock markets. But the fact is the American stock market is well below the average of global markets. And that suggests that it's a global factor, not something about American policy.
Larry, sorry, but it's more than my instincts. You come to Brooklyn, where we've got Lutheran Hospital, which is now part of NYU. It was hard work. It was changing management. It was infusing technology. The people that are there now have much better quality health care, and they're all getting it.
Ken, you've done great. You've done great things in many places, including at that hospital, and your leadership catalyzed all of that, and I admire
Bob Grossman, the dean, he's the guy that did it.
All right.
But I admire the things you've been part of. But at the same time, you have to look at the data on what the patterns are all across the country. And I don't see how you can believe that if 10 million, 13 million, whatever exactly the number is, of people are going to lose health insurance, that's not going to have health consequences, even with great efforts like the ones you're describing.
Okay.
All right. We'll leave it there. Thank you.
Thank you.
Secretary, great to see you. When we return.
Thank you. Good to be with you, Ken.
Good being with you, Larry. Hope to see you soon.
Jim Cramer will join us. He's licking his wounds a little today.